we have an example of a patient who was sent to us from another hospital after the patient had undergone a placement of a metal stent for a esophagus cancer. Unfortunately, the stent was placed across the stomach and the esophagus at the G junction into the pleura and peritoneum. There was a big perforation. So the patient developed sepsis and underwent open surgery. But the main thing the surgeons could accomplish was to place some drains, and they placed also a gastrostomy tube to feed the patient. But they noticed that there was a complete dehiscence of the anastomosis between the stomach and the esophagus, actually between the connection of the stomach and the esophagus. So what did we do? We performed an upper endoscopy, and during upper endoscopy we realized that the wire was going into the abdominal cavity.